Hi guys, thank you and welcome back to this channel. I'm so blessed. Look, today I got invited on this cruise, so I decided that I had to do this CANster and talking about Perryn. As you know, the last video, well, I gave some information until she was about 6 years old. So today I'm going to talk about the process of her bone marrow transplant. So then I have to rewind a little bit about Pam, because when Pam was found to have this disease called Fanconi anemia, which is a very rare blood disorder, and at that time she was 8 years old and I was pregnant with Perryn, and so the doctor said they wanted to check if this Perryn would be affected as well, and I said no. I said I just trusted God to do the miracle healing. And indeed, after I went for a short trip with Pam, and when I was really pregnant, and came back and the report was negative after the test. So I was so confident that Perryn was going to be very well. But unfortunately, when she just turned 6, one night at home, she was running a fever, and then blood flew out from her eyes. It's not natural. Instead of tears, it was blood. So can you imagine how we really feel about it? And the doctor said, look, because the body cannot take the condition anymore. So the only chance was that she should go for a bone marrow transplant. And of course, looking for a donor was no easy matter. But God was so good. God sent my son, Iran, who was 1 year younger than Perryn, and Iran was like a perfect donor for her. So when everything matches, we said yes, now let's go for the bone marrow transplant. But because the disease was so rare, and in Singapore there was not enough experience to do that transplant, so the doctor had recommended to go to New South Wales Children's Cancer Hospital in Sydney. So there we went, and Perryn indeed was placed in the hospital where there were 4 wards for children who undergo different kinds of transplant, mainly the bone marrow, but on according to different conditions. But the problem was, when we look at the natural, the right side of the room and the left side of the room, the children didn't make it after the transplant and during the transplant. So we were so troubled. We were so afraid, because that decision was not from them, it was from us. So we wouldn't know whether we actually make that right decision for them. But we persevered, we prayed, we asked the Lord. So we felt that the transplant would be good. But then the night when the morning she was supposed to be transplanted, right? And they did all the radiations and all the chemotherapies to really clear her system out, to be really clean, and waited for to harvest the bone marrow from the brother. And that night, Iran ran a fever, and the fever did not cease until the next morning. So the doctor came and said no way, they couldn't do the transplant. And this went on for 2 nights. So on the 3rd night, the doctor told us, if next morning we can't do the transplant anyhow, so she has to take a rest, and then she had to go through the procedure of chemotherapy and radiotherapy again to clear her system out again. We were very troubled because it was very, very damaging for Perryn, especially at that tender age. So we prayed that night, and somehow the phone rang almost like 11ish in the night, and a girlfriend from Singapore called and said, I prayed for you and I felt that God said you have to anoint your children with oil. So I ran down, I remember, to a 7-Eleven in the cold winter. I bought a big bottle of olive oil. We came back, and I just knew that this would be the way for them. So anointed them with oil, anointed ourselves with oil, and guess what? The fever actually left Iran. And the next morning at 8 a.m., the doctor came and checked on them and said, okay, let's do the transplant. So it was so wonderful. So indeed, Perryn went through the transplant successfully, yes. and it is all God's provision, and we just want to give glory to God. So this is the transplant, one part of it, and I will tell you more about the recovery. Thank you so much for tuning in. I wish you all well, and let's continue to be a CANster. God bless.